Yes, so today there is a case of celiac disease. We'll understand the dynamics of celiac disease. Wonderful case. Before that, there are few things. Our mind is like, whenever there is a patient, the mind of the patient is like a crime scene. So there are various negative thought processes which are the criminals that has caused the pathology or a problem in the child, in the patient. So say for example, there is a crime scene and one lady is lying on sofa, she is dead, there are pills scattered, there is a suicide note, police people comes and they say that okay, this is suicide. So many people they come and they said this is a suicide case, clear cut suicide case. Then one intelligent detective goes to the crime scene and he says, just for 2 seconds he sees and he says, no, it is not a suicide, it is murder. Why? Why he said like this? So our case taking is like this only. Small trivial details are very important. Okay. For suicide, you need a glass of water in order to gulp so many pills. Where was that glass of water? There was no glass of water. Okay, so this is common sense. So very small details, they actually change the whole scenario, and we fall prey to psychosis. So in a haystack of lot of data, previously Dr. Akshat had presented a very beautiful case of OCD. So the analysis was very beautiful analysis. So the information which we are getting, how do we connect each tidbits of information and form a rubric? So this is very important. So this should be our approach in each and every case. So this is a case of celiac disease in a child. This 7-year-old boy comes with recurrent pain abdomen followed by vomiting, loose stools. This phenomena happened when this child stopped mother's milk. After this situation started. Vomiting used to continue for a day or two, which used to make him very weak. Continuous vomiting. Small amount of wheat or chapati when he used to eat, vomit, and diarrhea, and he used to collapse. So such was the situation. Recurrent cough and cold tendency was there. So these two problems, one is the celiac disease, second is cough and cold tendency recurrent. So diagnosed as celiac disease. So he was diagnosed as celiac disease. So he was diagnosed as celiac disease. Anti-TTG was more than 500 units. Okay. So what is celiac disease? It is basically autoimmune disorder, primarily affecting the small intestine, where individuals develop intolerance to gluten present in foods such as wheat, rye and barley. So autoimmune reaction against the nutrients which are supposed to give nutrition. Okay, remember this. So this is autoimmune reaction against what is supposed to give you nutrition. So as you all know, only effective treatment given is a gluten-free diet. Patient will never be able to eat wheat throughout the entire life. And mostly because this is an autoimmune disorder, autoimmunity is just one step before genetic mutation. So mostly if they are in a state of again and again, if they are eating and falling sick, then there are chances of getting into CA, like intestinal lymphoma, and there is a risk of early death also. So there is an inflammatory reaction to gliadins and glutenins. These are the gluten peptides which are found in wheat and Triticale family and oat family. So these are the proteins against which there is an autoimmune reaction. Wheat subspecies and wheat hybrids also cause symptoms of celiac disease. So anything related to wheat and wheat hybrids will cause celiac disease. So what is the genetics of celiac disease? See, there are proteins which are coded by chromosome 6. Okay. So these are the HLA-DQ1 and HLA-DQB1. These are the proteins which are coded by chromosome 6 genes. Now what happens? This HLA-DQ, it distinguishes between self and non-self for the purpose of immune system. Okay. So the differentiation between self and non-self in the GI tract is because of this particular protein. Then this HLA-DQ, which is coded by the genes. So this HLA-DQ has two variants, HLA-DQ2 and DQ4 to DQ9. Out of this, in celiac disease, HLA-DQ2 and HLA-DQ8, these two genes, they release isoform proteins. Okay, so the isoform proteins are being released. What are these isoform proteins? They are like the same proteins, but they have a slightly very similar proteins than the original protein, but there is a slight change. Because of this slight change, whenever a person eats that gluten, so the gliadin peptide which are present in the wheat, they are attached to these receptors, DQ2 and DQ8 isoform receptors. So the bonding becomes very strong. It becomes so strong that it generates immune reaction. So autoimmunity takes place. So it is because of this. So excessive or tight bonding of this antigen presenting receptor with the gliadin peptide causes immune reaction. So now the question is, why this child suffered? So symptoms started when child started eating wheat. Now sensitivity to this disease started in the womb itself, is in the intrauterine life, as we all know. Then pregnancy history, what about it? So this mother got pregnant after 1 year of marriage. Further, what happened? Mother-in-law had already expired, one wicket down. So husband expired during 3rd month of pregnancy in a road traffic accident, which was shocking for her. Okay, so during this time, the husband expired in a road traffic accident. Now, whether this incidence is affecting the celiac disease in the child, no or yes? No. Why no? Separation hai. It is a form of separation. It will cause a shock, it will cause grief, it will cause sadness, but not anger. Because we know the mathematics of celiac disease. Any emotion will not cause any pathology. So this is not important. Then during 5th month of pregnancy, father-in-law married an illiterate lady, which she was not able to tolerate. So now comes the part of the anger. In my family, all are officers and we have got money, and such type of lady dare enters in my house. Okay, so that much anger. How dare that illiterate and Gawar lady there comes into my house? Because there all are big officers, and so it is like that. If I knew that father-in-law would do such a thing, I would never have married in this family. I would have known before about this lady. I would have never married. So that was the amount of hatred for that lady, hatred for father-in-law. My child's property will be given to this lady. It is better to die with my child inside than to rather see this situation. Nothing will be left for my son. Okay, so here comes the autoimmunity. As simple as that. So father-in-law was very strict and dominating. He never agreed to what people advised. Okay, so he was very adamant, very rigid. So now, if we analyze this whole situation, what could be the reason for celiac disease? What rubrics can we form? Simple है, very simple. Death desires, one. Second, वो डाइजेस्ट नहीं हो रहा. सी व्हाट इज wheat is supposed to give nutrition. ठीक है ना, nutrition should come from outside, and now in this house who is supposed to take care? Father-in-law, because husband is dead. So father-in-law is the wheat, and what this is doing to her? Creating indigestion, because he is doing things which is very much offensive for this lady. So that corresponding indigestion in the mind of mother going into indigestion in the child. Yeah. So child's problem is gluten sensitivity and cough and cold. Remember, we forgot cough and cold. And we were focusing only on this. So wheat is sora, supposed to give nutrition, and wheat is causing vomiting and diarrhea and indigestion. So indigestion in the child came from indigestion from the mother's mind. So mother was angry about wrongdoings of father-in-law, agreed. She felt humiliated and had a regret about the decision of marriage. So there was a strong regret. No future for my child. Okay, so this was the indigestion and no future for my child. So the rubrics which I took was remorse, death desires, these two rubrics. Aurum belladonna. Okay, now I already gave prescription from this. The purpose of presenting this case is whether we can still think a deeper rubric from this scenario. Because I know the medicine, now whether retrospectively, if we study this case, whether we can find a delusion or a deeper rubric through that we can enter, we would have entered into this case. So can we still think deeper about the mind of the mother? So rubric should have autoimmunity and anger component. Family member has destroyed the future of family. So something is being destroyed. Mother is angry about it. Husband is dead and property will be given to the wrong hands. What will happen to us? This is the scenario. This is our analysis. So possible rubrics, delusion, imagination, ruined will be, as simple as that. What do you mean by ruined will be? खत्म हो जाएगा. But ruins के अंदर में at least something should remain. It is not total gone. Property means ये गया तो गया, बचा कुछ नहीं है. ठीक है, तो ruins of Mohenjo-daro, Harappa, something is there. Majority part is gone, but something is there. So ruins का जो meaning है, it is this, that some part will remain, majority will be gone. So can we take this? जाएगी तो पूरी जाएगी. according to the perception of mother. Then delusion, imagination, dark off, that something is dark, what is going to happen, uncertainty feeling, delirium, groping as if in dark, whether the mother was groping, where and what is going to happen. Then ultimately what happened was, she shifted to her parents' house because she was sure that this thing is not going to give me some benefit. So imagination, annihilation about to sink into, this is another rubric. Okay. So out of these 3-4 rubrics, possibilities, what could be our possible rubric? Annihilation, as simple as that. Because everything will be lost. That lady, if she is coming, means she is the possessor of the whole property. She will possess that whole property thing. So annihilation about to sink into Calcarea, cannabis, carbon, carcinosin and monody. And so Calcarea carb I had given to this child because child is timid, scared easily, slow, chilly, thirsty, profuse perspiration of scalp, wants mother and mama by his side. So Calcarea carb was given 1 1 dose and was repeated when the child had upper respiratory and obstinate cough. The same dose relieved the child. There is a follow-up video. Okay. Okay, we'll see later on. So, the journey of Calcarea, let us study few points of Calcarea, let us understand. So, journey of Calcarea is from safe to unsafe environment. Okay? When Calcarea is safe, that is a compensated state for Calcarea, and when that safety is gone, then Calcarea becomes ill and goes into a state of pathology. Second situation is excess protection, and when that protection is gone, Calcarea faces the reality of the world. Then he sees that, oh, this is reality. This is, I was, nowadays parents are too much protecting, very protective. Small thing means they will overly protect the child. Don't go there, don't do this, don't do that. So that overprotective behavior will not allow the child to grow. The brain growth will become less. The child will never know what the world is like outside. He will never face the reality, the situations outside. So delusions of Calcarea, when the child or when the Calcarea is in a state of security, he is a state of happiness. So that is the delusion of wealth of Calcarea. Stage of security is wealth for Calcarea. For sulfur, wealth is something different. Then floating air in. Now this I am starting with the compensated or the happy Calcarea. When Calcarea is happy, there is delusion of wealth, delusion as if floating in the air. Delusion, elevated air, elevated in the friend fantasy world of imaginary friends lives in. So what are friends? Friends are our support system. Okay, so imaginary friend means he thinks that there are a lot of people who are going to support me. So this is imaginary world of friends. Delusion, money talks of. So he'll talk of money when he is in a state of compensation. He will show money, boasting about money. The psychotic Calcarea. Then vision has wonderful. So when everything is fine, everything is good. So he is in a protective shell, in a protective area. So everything is fine. Everything is wonderful. Delusion, walking cotton he walks on. So he'll walk on a very comfortable environment, as if there is no obstacle, no, everything is in a state of comfort. Change aversion. Now what happens is, this was the state where he was happy, he was comfortable. From this state of comfort, he does not want to change. He wants to be in that only. So most of the Calcareas, many Calcareas, so they will never change the job, they will never change their surroundings, they will never change anything. They want to be in that state of comfort because they don't want to take risk. If I take risk, something bad, then everything is gone. So there is a change aversion to in Calcarea. Change aversion to house or flat in. Okay, even in the personal life also, they do not want any change. Leave aside professional. In personal life also, they don't want any change. A Calcarea patient who was not living Udaipur. Why? Because he was a very pampered child. He is now 35. Pampered child, not living Udaipur, because he has, even though he has opportunities outside about the job, but मेरे मम्मी पापा यही है, they will pamper me, उनका support है, how can I leave, है ना? So Calcarea will, most of the time, if they are psychotic, they will talk in the other direction. Sir, it is my duty, my parents. So they will talk like that also. In fact, the thing is opposite. So they are seeking support from parents. So yes. Why they want to take support? Because they don't have that confidence. So they feel that I am inferior, I have no talents. And even the environment has so much supported them that they lack that confidence because they cannot face the outside world, outside situation. So, no talent, no confidence, now face the world. What is going to happen? Fear change of any sudden. If any change, then now starts the fear complex. Fear cruelties from report of. Because if anything is happening in the world, it is going to affect Calcarea because he will have the perception that some or the other day I will have to face this situation. So there is a fear. Fear evil, fear of overwhelming her. That evil things will overwhelm her. So they will take control of Calcarea. That is the perception. Fear, full of fear, always full of fear. Fear of the unknown. So if something is unknown, Calcarea straight away has a lot of fear. When Calcarea comes to your clinic, Calcarea will straight away say, Sir, मैं बहुत डरा हुआ हूँ. I am totally scared of this disease. Otherwise, Stramonium, who is very fearful, very frightful remedy or personality, they will hide because Stramonium is in affectation, Calcarea is not in affectation. Okay, so remedies who are in affectation will try to hide their fear. Calcarea will never hide the fear. Straight away they will tell. This is a subtle difference between Calcarea and Stramonium. Fear unreasoning. Okay, so there is no reason behind that. Again, there is a fear. So the entire world of Calcarea, the entire situation by Calcarea is being perceived as fearful. Okay, everywhere, whenever there is any situation, the perception is fear. So the Calcarea is genetically trained to perceive these fears. Delusion, small body is smaller because there is lack of confidence. So delusion, small body is smaller. That what case we had discussed in a child, that what has gone after Calcarea. Okay, so recently his father met me and he saying that warts are all gone. We had given some other remedy. Carbonium sulf previously were given and then we changed to calcarea and it is gone. How do we arrived at a case? So he was living in a area where big shots are living. So he would be playing with those kids of the big shots. Now what he will say when he goes home? Ki, father, I want Mercedes, I'll buy this, I'll do that, I'll do this. But in the reality, neither he will study nor he will do anything. So we thought that why is he projecting things like this? Because somewhere there is a lack of confidence. So this rubric we took, delusion small, body is smaller. So Calcarea removed the warts. Then delusion anxious. So when there is a fear situation, when there is exposure. So for Calcarea, how fear starts is from exposure. If there is exposure out of the outside environment, outside situation, then anxiety and fear starts. This is again a delusion because there is no need to be anxious, but still it is making Calcarea anxious. Bed someone, under the bed someone is knocking. So when there is any stress, whenever there is any situation for Calcarea which is uncomforting, bed is the place of security and comfort. If that thing is getting disturbed, so Calcarea causes anxiety. Delusion, confusion, others will observe her. So Calcarea need to be very careful. I need not expose my weakness because everybody is trying to overpower me. So I need to be strong. I need to project as if I am strong. So observe confusion, others will observe her. Then delusion, falling he is. Delusion, home away from home. So falling he is means whenever there is situation, fear situation, what is going to happen is falling. Home away from home. Falling means there is a constant downfall in each and every situation when he is not able to handle things. So he is falling. Home away from home he is. Home means a place of security. So always a feeling that काश मैं उस स्टेट में होता जहाँ पे मेरे पेरेंट्स मेरा ध्यान रखते थे. I was dependent on them. They used to pamper me. They used to support me. So now I am like this. So most of the Calcarea will think about their childhood. Okay. So even in developmental disorders, Calcarea is a very good remedy. When there is a lack of brain development and the child does not want to grow, even in PCOD also, because there is the child or the girl child does not want to mature, so there will be immature follicles. Okay, see, when there are immature follicles and there is bulky ovary, in that situation there is different scenario. And if there are multiple follicles with normal sized ovary, this is another scenario. Okay, so immature follicles with bulky ovary means what should be the conflict? What should be the cause? Shelter protection wanting. So what should we be probed for? See, immature follicles means person doesn't want to grow. ठीक है ना? I do not want to grow. So we need to find where is the immaturity. So there was a patient who had this immature follicles with normal sized ovaries. She was not able to calculate. हिसाब करना है तो I'll have to count like this or even calculator. Even looking at the time, 11:30 पौने 12 में confusion है. So this is the maturity. So these things are important now. And another thing is there is a constant feeling of lack of confidence that I am not talented, I am not like other people, they are so talented, whatever I do, I will never achieve success. So these things contribute for the PCOS. Then second scenario is multiple follicles with big sized ovaries. Why big sized bulky ovaries? Bulky ovaries will take place, the size of the ovaries will become larger in order to compensate. Compensate for what? Loss. So here we have to find the loss conflict. Okay, so in the pathological report, we should read very carefully what is the report given. So here we need to find out what the person is losing in life, which is so much dear or important to her, what she has lost. Okay, so yes, tumble he would tumble means whenever he'll attempt to do something, he will fall down. So it shows the lack of balance, the lack of confidence, and instability or awkwardness. So turn things with her, things were turning. Now there is a state where I was secure and now again the things are turning. The exact opposite situation. Wrong, everything goes wrong. Now these are the delusions which shows that what is the perception to situation by Calcarea. Delusion animals, persons are animals. So those people who try to disturb Calcarea, those are being perceived as animals. Delusion fire vision off. Okay, fire vision off. Later on I'll explain how is this fire vision off. Horrible everything seems. Horrible everything seems means whatever is the situation, it is horrible only. Even though for Nux vomica, it is normal situation. For Calcarea, it is horrible. Images, phantom sees, closing eyes on. Even when he moves away from the situation, even when a person closes the eyes, the fear remains. On closing eyes means there is a constant fear. Delusion rats sees. What is rat? A rat is an animal which betrays you, which deceives you. You rat. So rat means somebody who will betray you. धोखा देने वाला प्राणी is rat. So उसको लगता है कि ऐसे प्राणी हैं जो धोखा देंगे. Snakes in and around her. Snakes, danger. So people around me are dangerous and they are going to bite me and harm me. Specters, ghosts, spirits, closing eyes on. So this is very important. On closing eyes, the fear will remain in Calcarea on closing eyes. Okay, if the eyes are open and there is a situation there is fear, it is fine. But even when you are out of that situation, that fear is so much imprinted on your system, on your genes. Yes, so what are the problems or pathologies which are associated with this imprintment of fear? Respiratory, what else? Kidney. See, when there is fear, fear causes growth. Okay, na? There is fear and insecurity causes the tissue growth in order to compensate. So anywhere cysts, tumors, okay, problem with head of the family, tumors in the brain. So like that, these pathologies will be covered. Then in the lungs, you will get all these tumors and asthma, these cancers and all. In the abdomen, hernia. Fear will cause looseness. Out of fear, we will have looseness of the parts. So it may cause the looseness of connective tissue, because fear may be somewhere connected to loss of confidence. Okay, so fear may be connected with loss of confidence. So when there is loss of confidence, so the connective tissue will become loose. So there are chances of even hernia and prolapse also. Then, okay, vision has horrible. Okay, this is important. Yes, later on, when the situations are not manageable, delusion, disease, incurable disease he has. And what is incurable disease? Anything which is giving discomfort is disease. Incurable means something which is not manageable. Now the situation cannot be managed. So this is incurable. Insane, become insane one will. Okay. So the thinking pattern, the logical thinking will be gone when there is so much fear, so much cortisol in the system. Delusion, murdered will be murdered he. So because I am weak, anyone can overpower me and they can finish me. As simple as that. Persecuted, anyone can persecute me, anyone can harass me. So finally, in a state of panic, run up and down and scream she would like to run. So this is a state of panic where you will get a sense in the case that this patient is metaphorically running up and down and screaming. So yes, if we correlate with the Calcarea situation in the pregnancy, we can find out few rubrics. Okay, 5th month of pregnancy, all are officers. So father-in-law would do such thing, I would never have married this family, my child's property will be given to this lady. It is better rather to die than to rather see the situation. Father-in-law very strict. During 5th month of her pregnancy, father-in-law married an illiterate lady which she was not able to tolerate. So this was the statement, and correspondingly this is the rubric. Delusion, bed someone, over the bed someone is. Okay, now do you get it? Bed someone, under the bed someone is. Okay, so now that lady has come in the comfort zone of this pregnant lady. Bed someone, under the bed someone is knocking. Now I am coming for the property you have to give. So in my family all are officers and we have got money, and such type of lady dare enters in my house. So this is delusion of wealth, as simple as that. Then I know that father-in-law would do such a thing. I would never have married in this family if I would have known before about this lady. So delusion, wrong, everything goes wrong. Everything is wrong. The father-in-law is doing wrong things. Horrible everything seems. So this is horror for her. Horrible. Vision has horrible. Even she closes the eyes, this situation will remain for her. It will never vanish. Father-in-law and husband always fighting. This is delusion, fire, vision off. Constantly fights. Fire, vision off. So there is no peace in the house. When there is no peace, there is constant agitation and the relations are being destroyed. So this is delusion, fire, vision off. My child's property will be given to this lady. It is better to rather die with my child inside than to rather see this situation. This is delusion, ground elastic as if floor were. So my base is loose because there is someone to take charge in this house. So where is my value? Where is my where is my stand in this entire house? Delusion, ruined is ruined he. Afterwards, if the property is given, then she will be ruined and she may go into a state of annihilation about to sink into, which she is thinking right now. Delusion, murdered will be murdered. So actually he has already murdered because he has done such thing which has so much offended her. So her reputation he has disturbed, he has slaughtered the reputation, he has done such a thing in this age which he never expected. So yes, so this was the case of this child. पॉज कर दो इसको अब इसको ठीक है। अब कोई तकलीफ तो नहीं होती? पहले के रोटी खाने में क्या होता था? ठीक है। और अब रोटी खाते हो? कोई तकलीफ? So whenever he used to eat chapati, he used to vomit and he used to collapse. Now after 6 to 7 months, he is now able to eat wheat very nicely, and his immune system also has become very proper. So now he is off the treatment from last 1 or 2 years. Okay. So this was the case of celiac disease. Remember the approach